Depression is a mental illness which affects the way people feel. It causes a person to feel very down and sad. There is very little scientific evidence to support the cause of depression, though it has been linked to life events. Here, I am joined by an expert today in depression. Good morning, Cody.
Good morning.
Could you tell us some facts about depression?
Sure thing. Depression affects around 1 million adults in Australia. There is no known cause of depression though. There are many factors such as environmental, genetic, psychological. These can include drug and alcohol abuse, personality, suffering from other medical illness, traumatic events in life. Symptoms of depression can also include staying indoors often, feeling sad, also sleep problems.
So, Cody, how can these affect young adults such as myself today?
Well, Joshua, they affect us in many different ways. Oftentimes, people will not be able to motivate themselves to do any work, which is a problem for students. As I said earlier, sleeping is a major issue affecting teenagers, as sleep deprivation is also a rising issue in teenagers. Scientists have also shown that the hippocampus, the part of the brain responsible for emotions, tends to be smaller to people who have depression.
So, in today's society, what are some possible treatments for depression?
In terms of psychological treatments, people can look towards treatments such as cognitive behavior therapy or CBT, interpersonal therapy (IBT), and mindfulness-based cognitive therapy (MBCT).
So, could you go down just a basic rundown on these therapies?
Well, the CBT is a structured psychological treatment which recognizes that the way we think and act affects the way we feel. It involves the patient working with a therapist or professional to find the thought and behavior patterns that they're either making you feel more depressed or stopping you from getting better when experiencing depression. It works by changing your thoughts and behavior by teaching the patients to think rationally about everyday difficulties, helping the patient to shift from negative and unhelpful thought patterns and reaction to more realistic, positive and problem-solving approach.
And so, IBT is more psychological therapy, which helps with personal relationships and skills needing to deal with these problems, right?
Yeah.
And MBCT is more of a group therapy session where they go through mindfulness meditation. So these can help patients whose minds are wandering off.
Yeah, exactly. You got it right.
And there's also another form of medication that we can go through is actually antidepressants. And what are the types of antidepressants that we could see on the market? So would there be some examples like SSRIs, SNRIs, and RMAs?
Exactly, those are the ones.
So thanks for your time today, Cody.
Thank you very much.
Subscribe and stay tuned for the next podcast.